Hello and welcome. Today, we're going to peek behind the curtain at a part of the body that works tirelessly, completely out of sight, the urinary system. We're going to unpack the radiologist's toolkit and discover how modern medicine creates these incredible images of such a vital network. All right, let's get right into it.
Yeah, it's a brilliant question, isn't it? The answer is this amazing field called uroradiology. It basically gives doctors a window into the kidneys, the bladder, and all the plumbing that connects them, all without ever having to make a cut. It's all about making the invisible visible.
So here's how we're going to break it down. First, we'll look at why we even need to see inside in the first place. Then, we'll explore the 4 main techniques radiologists have up their sleeves. After that, we'll get into the basics of reading the images, touch on some more advanced tools, and finally, we'll see how it all works in practice when looking at a kidney infection.
Right then, first things first. You might be wondering, why go to all this trouble? What is the big deal about imaging the urinary system anyway?
Well, it really all comes down to 2 key things: structure and function. Doctors need to see the structure, the anatomy, the shape and size of everything. But they also need to know about the function, the physiology. How well is it all working? Are the kidneys filtering properly? Is everything flowing the right way? Imaging gives us the answers to these absolutely crucial questions.
Okay, so how do they actually do it? Let's open up that toolkit we talked about and take a look at the main instruments of the trade. There are 4 main ways they go about this. You've got ultrasound, which, as you probably know, uses sound waves. Then there's something called intravenous urography, or IVU for short. Next up, one you've definitely heard of, computed tomography, the CT scan. And finally, you have radionuclide scans, which are really more focused on function than on the actual form.
And this table here is a great little summary. You see, things like ultrasound and CT are fantastic for looking at the physical structures, the anatomy. Radionuclide scans, on the other hand, are pretty much all about function, how well everything's ticking over. And that old school IVU, well, that one kind of sits in the middle, giving you a little bit of both.
Right. We know the tools. So what do the images actually look like? Let's try to see things through a radiologist's eyes, starting with a real classic. This is what's called a KUB. Yep, KUB. It stands for kidneys, ureters, and bladder, and it's basically just a plain old X-ray of your tummy. It's often the very first thing they'll do, a quick and easy starting point that can give some early clues, but, and this is a big but, it's definitely got its limitations.
And get this, because it's a really key point. This type of X-ray will only actually spot between 40 and 60% of urinary tract stones. That's it. Why? Well, a lot of them are just too small, or they don't show up well, or they're hidden behind things like bone. So the main takeaway is, just because a KUB looks clear, it absolutely does not mean you're in the clear.
So, when a specialist looks at a more detailed urogram, they're running through a sort of mental checklist. They're asking, are the kidneys where they should be? Fun fact, the left one's usually a tad higher. Are the outlines nice and smooth and symmetrical? Is the main working tissue an even thickness all the way around? How does the bladder outline look? Anything that deviates from this normal picture could be a sign that something's up.
Now, this is a perfect example of how tricky this can get. It's all about telling the difference between what's just a normal variation and what's actually a sign of damage. See on the left? That's called fetal lobulation. They're just some bumpy bits left over from when the kidney was developing. Totally normal. But look at the one on the right. See that sharp, deep dip? That's an infarct scar. It's a really subtle difference, but telling them apart is absolutely crucial.
And this brings us to a massive shift in how things are done today. That classic IVU we talked about? It was the king for decades, but honestly, it's pretty much been replaced. Nowadays, it's all about a combination of ultrasound and especially CT urography. The CT scan is just way more sensitive, particularly for stones, and you don't get all that messy, overlapping stuff in the way.
But what if those first few tests don't give a clear answer? What if the mystery isn't solved? Well, that's when you call in the specialists, the really advanced imaging techniques.
Okay, so take a DMSA scan. For the person having the scan, it's pretty straightforward. You get an injection of a tiny, very safe amount of a radioactive tracer, and then you just hang out for a few hours. This tracer gets soaked up by all the healthy, working parts of the kidney. So when they finally do the scan, any dark spots, any areas that haven't lit up, well, that's where there's scarring or damage. It's an unbelievably precise way to map out problems. All right, next up is the VCU. A bit of a mouthful, I know. This one's a big deal, especially for children who keep getting infections. A tiny tube is used to fill the bladder with a special dye that shows up on x-rays. Then they basically take an x-ray movie while the person is having a wee. And what are they looking for?
They're checking to see if any of that dye goes the wrong way, back up towards the kidneys. That backward flow is called reflux, and it can be the root cause of a lot of trouble. And here are a couple more super specialized views. Over on the left, that's a renal arteriogram. Think of it like creating a detailed roadmap of all the blood vessels feeding the kidney. This is vital stuff for surgeons, or if doctors are hunting for a cause of high blood pressure. Then on the right, you have a urethropography. It's the same idea, but it's making a map of the urethra, the tube leading out from the bladder, and it's brilliant for finding blockages or damage. Okay, we've seen the toolkit. Now let's see how it all comes together in a real-life situation. Let's talk about a kidney infection, or to use the proper medical term, acute pyelonephritis.
Now, the first thing to say, and this might surprise you, is that for most adults with a simple, uncomplicated kidney infection, you actually don't need any scans at all. The diagnosis is usually pretty clear from the symptoms, and they'll just start treatment with antibiotics.
So when do you need a scan? Well, there are a few key situations. If someone's not getting better on antibiotics, that's a huge red flag. You've got to look for something more complicated, like an abscess or a stone that's causing a blockage. And this is so important. Every child with a proven UTI gets imaging. You have to check if there's an underlying problem, like that reflux we talked about earlier. And this table shows you what the different scans might reveal. With an IVU, you might just see some swelling. With ultrasound, well, this is the tricky part. It can look totally normal even when there's a nasty infection. But with a CT or MRI using that contrast dye, now you're talking. You can actually see these patchy areas that react differently, and that, right there, is why CT is the go-to when things get complicated.
So it all comes back to this, really. We've seen a massive evolution here. The IVU was the standard for years, and it did a decent job. But technology moves on. Today, CT urography is the undisputed gold standard. It's just better. It's better at finding stones, it doesn't get confused by shadows and overlapping bits, and it shows you everything around the kidneys too. You just get a much, much clearer and more reliable picture.
At the end of the day, uroradiology is a fantastic story of how modern medicine learned to see the invisible. It's all about turning these hidden, complex problems into clear pictures that doctors can use to make people better. And it really makes you think, doesn't it? As this technology gets more and more sophisticated, what other secrets of our internal biology are we going to uncover next?